From the Zoomerplex in historic Liberty Village, theZoomer, hosted by Marissa Lennox.
Welcome to theZoomer, I'm Marissa Lennox. Today we're tackling men's health. Canadian men, while nearly half the population, live about 4 years less than Canadian women on average, with fewer years of good health. They're also more likely to die from diabetes, heart disease, and liver disease. Part of it is men aren't prioritizing their health as they should. Over half of Canadian men are struggling with insufficient sleep, lack of exercise, and an unhealthy diet. Alcohol consumption and mental health are also major factors. 1 in 3 Canadian men engage in risky drinking, and by age 40, half of Canadians will have faced a mental health challenge. So today we're zeroing in on men's health, and while we'll focus primarily on men, let's not forget women and partners play an equally crucial role in supporting their health journey. So let's jump right in. Welcome to all of you in studio today. Dr. Elterman, I'll begin with you. Why aren't men prioritizing their health?
I think there's a lot of reasons for this. Certainly there's this masculinity and masculine persona that you sort of don't need to ask for help, and so a lot of men are just going to sort of internalize it and try to deal with issues as they come up by themselves. Also, I think men sort of fall off the back end of the healthcare system. They see pediatricians, and as they get into adulthood, they get wrapped up in work and other sorts of activities, and unlike women who go through reproductive years and stay engaged with their doctor throughout the years, men oftentimes won't go to see a doctor until something happens much later in their 40s, 50s, 60s, for example, and it's usually a major event, and that's what brings them into the doctor.
Are men less likely to go to the doctor? I've seen some studies to that effect.
So the truth is that along with the machismo bravado piece, men are less engaged with their care, both because of opportunity as well as because of ability, right? When you're sort of working throughout the day, and it's not to suggest that women don't work just as hard, but when you're working throughout the day and the system is set up so that appointments are scheduled in short bits of time and doctors have very small swaths to see patients, middle of the day appointments become very challenging to make. And as a result, it's not just the biological aspects, but the social aspects as well that prevent men from really zeroing in on their care. And I think that the comment of remaining engaged throughout life with reproductive health in women is a very important one. It's very easy as a male to put it off until tomorrow, until it really becomes an issue.
Is it also a fear? Is there a fear there?
I mean, I think there's part of that. I work in the men's mental health space. I think one of the issues also is that we don't do a really good job at creating space for men and kind of communicating to men. When I did my master's degree, I noticed I was one of only a few men, and I asked myself, is it true that men don't ask for help? Or is it possible we don't do a really good job at kind of communicating and offering spaces for them? So that was the genesis. The clinic I created was called Men Therapy Toronto. I just wanted men to know that other men are going and get help. And so I think part of the problem is, yeah, maybe there's some issue, but the pathologizing of men, that maybe it's something within them, I don't know if I'm on that side. I'm more thinking about we need to do more to create spaces for men to feel safe and comfortable to kind of go and do their work.
So do more to make space. How do you move the needle on this? How do you get men talking about their health, confronting the fears that they may have about their health?
I think campaigns like Movember have done an amazing job over the last decade or so to really bring awareness to men's health issues. And I think even creating men's health programs within community settings, hospital settings. One of the things that we're working on at the University Health Network is a men's health program. We have women's hospitals, we have children's hospitals, which are specifically designed to care for their unique needs and communicate with them. And I think having, as we said, maybe a space where men can come in and look through their lens might really bring them back into the healthcare system.
I mean, it's true, further to what Dr. Elterman said, it's not just the reproductive years that bring women in, it's the constant, women know, okay, there are pap smears, there are mammograms, there are always reminders about these things. Men don't really have that equivalent thing where they know, oh, I have to make an appointment at the doctor. They don't know why. And even it's been actually more of a negative the past few years when there's been this, we don't do physical exams anymore. A lot of men didn't know what to take from that. They said, well, I guess I don't need to go to the doctor, which is not true. You need to go to you should be seen periodically to check things like, that you may not be aware of, like your blood pressure, your cholesterol, these things. So we haven't really, found those reminders for men as we have for women.
All right, we need to take a quick break. When we return, what every man should know about their prostate health. Next.